with. I have like GERD, which I get really severe heartburn, indigestion, stuff like that. I felt a lot of that pressure get released right there. Back issues. Oh my God, that felt so good. My knee and stuff, days when I'm dealing with a lot of the swelling. I've been dealing with a lot of tension in my neck. Oh, that feels so good. This side is worse. The therapy, the treatment, it works. It works. As always, brand new woman.
Hey guys, Dr. Claire's DMV chiropractor. I'm here today with Valentine. You are back.
Hi.
This is what, your third time, right?
Yes. Yeah.
Okay. And you're also going to start helping us out, like a stretch assistant type of thing?
Yeah. And unfortunately, due to all of my personal orthopedic issues, I know what to do.
You've been through therapy.
Yes, I've been through so much therapy. And I think a total of, since I had to do 3 to 4 months prior to my first surgery to get the inflammation down. Right. And then, of course, following the knee surgery, had to do 6 months of therapy there. And then with the shoulder, 6 more months of therapy. Okay. And then recently another, it getting banged up again from another car accident, had to do another about 2-3 months of surgery. So what's that, about a year and a half?
That's a lot of,
therapy. That's a lot of therapy.
So you had the shoulder, right?
Yes.
And then which knee was it?
My left knee.
You had surgery on that left knee as well?
Yeah, so he did, I think he didn't have to repair my inner meniscus. He went in and took out the part that was damaged. Okay. And then he repaired my ACL. Okay. And got that back together. But when I initially came out of surgery, it wasn't straightening as it should have. So he had to go back in and do a manipulation on it to break up all of that scar tissue. And that was the worst, because you have to literally go right into therapy the very next day after getting the manipulation done, and you're still off of anesthesia, and they're pulling and they're tugging. And I was so nasty to the tech. I apologize.
Were you on drugs or something?
Yeah, I was still off of anesthesia. I was still off. And, you know, it was so funny because I got agitated, which, again, they're professionals, so we never want to be rude to our medical professionals. But forgive me, I was in pain and I was so tired. I was still off of anesthesia. But he looks at me and he's like, and he was new. He was just trying to get acclimated with doing his job. Right. But he looks and he says, which knee is it? And I'm like, hello, you know. So yeah, but it's really tedious. It's a process, but I'm telling you, the therapy, the treatment, it works. It works. You just have to do the work pretty much. Right. Yeah, you still have
to.
And it's effective. Yeah, it's very effective. And it's also a 2-part. You have to do 50%. So you go in, you get your therapy done, and then there's therapy you also have to do at home. And you have to be honest, and you have to stick to it. And it will be painful. It will be tedious. It is going to hurt, but it all pays off in the end if you want to get better and get back to being you.
See, that's why I tell my patients, I tell them that, you know, we do the work, but they also have to put in the work themselves.
Absolutely.
You know, like some of those, you know, exercises we show them, stretches, things they have to do at home, you know, to help themselves, you know.
Yep. If you come in my house, you'll see the bands hanging off of the doorknobs and all of that. Yeah.
All right. So let's get started. We'll assess you. And then after that, we'll adjust you and then stretch you.
Cool.
Okay? Cool. All right. So looking at your posture, you have pretty good posture, though.
I've been working on it because I started getting this little humpity hump right here. And I realized it was from me slouching too much. So I have really been trying to be more conscious of working on my posture.
Right. Because, you know, typically they have, we do have like postural devices that sometimes we recommend for people. Because the thing is, the way to work on your posture really is to exercise, you know, do these type of motions. Strengthen your back muscles so it'll pull you back. Right. Yeah. But, you know, some folks are lazy.
Yeah.
So they do have postural devices like, you know, braces to kind of help.
Yeah, that helps. I used to do a back brace when I had a more physical job. But once I stopped working that job, I didn't think to really wear it at
the lumbar brace.
maybe I should.
Yeah. We do recommend back braces, especially if you're going to do any like bending, any heavy lifting, because it keeps your lumbar stable.
Yeah.
So that helps, prevent injuries and things like that. All right, let's start with the head and neck. Your hair looks so good. I don't want to mess it up.
No, it's fine. I put a little spritz in there so they hang in there.
Let's see. Okay, so you have more movement on this side, right here, than you do on that side. So it locks up right
It's
there.
probably because of my shoulder.
Because of the shoulder. This is the
this
shoulder.
is the one I had a real ugly scar. But it healed very well. Yeah. It healed pretty
nicely,
good.
Yeah.
It
did. Yeah. So then that kind of limits your motion on that side compared to this side right here.
Yeah.
Okay, I got you. Let's go ahead and rotate you. Let's see how far you go. So right about there, you start locking up a little bit. Is it uncomfortable or is it?
I think it's because of that deteriorated disc in the bottom. Yeah. Because it's still somewhat like bone on bone down there. Yeah.
Okay, let's look at the rotation.
And I'm too young. I'm not that young, but I'm too young to not be able to tie my shoe.
Tie your own shoe. Right? You're still young. Young. Let's rotate this way here and see what happens. Okay, locks up a little bit right there.
Cracking a little bit.
I heard a little bit of pops there.
Snap, crackle, pop.
Yeah. Okay. Applying a little bit of pressure here. Oh, sorry about that. Yeah, still a little tight. Okay. All right. So let's start with your upper back and mid back area, and then we'll kind of work our way down. Good. Okay. So put both of your hands on top of my hand. Good. Now, what you're going to do, you're going to squeeze your shoulders together for me. Good. Is that uncomfortable for you?
It's okay.
Okay. I'm going to bring you back. Squeeze them a little bit harder.
Oh, shit. I'm sorry. I don't think we've done that one before. Oh, my God. That felt so good. Oh, wow. Yeah. Oh, that did feel good. Because I've been getting, like last night I was sitting doing my nails and I noticed right where you cracked it at. That's so funny you did that right. Because as I was sitting there doing it, remember I told you I've been working on my posture, so I was trying to sit up straight, but I still was having that aching right here in this spot. And I'm like, why? And I'm just sitting, like sitting up straight, but it was still aching. So I felt a lot of that pressure get released right there.
That's good. Have a seat.
Wow. Oh. And that's just the first one.
That's just the first one. All right. So let's do your joints. And then after that, we'll do your lower back and then we'll do the neck, okay?
All right. Readjust the girls.
All right. So just relax for me here. Okay. Okay, so go ahead and slowly move it back for me. Okay. All right, just slowly move it back. Okay, that's fine. Okay. Good, relax. I like the black. That's actually pretty cool.
Yeah, I usually do white, but I said let me step into the dark side. Cause let me do a message. They they try to tell us that black is for darkness, evil, all this and that. They always want to tell us that black is bad. But how about black is good and white is bad?
You have a story, behind everything.
Everything.
Right?
I'm a creative. I can't help it. Yeah.
All right, relax. Okay. All right, so we're going to do your ankles and then your toes and then your feet. Okay. So I'm going to have you on your back and then you can take your shoes off.
Okay.
All right. Okay, so it's the left. So this is the knee. We had the surgery.
Yes.
Okay. All right. So let's start with this first.
Okay.
Just relax it. Good. So your feet doesn't pop as loud as everybody else.
Okay.
Just relax for me here. Good.
Oh, that felt good.
Felt pretty good, right? Okay. So I'm gonna work on your feet. So I'm going to do some myofascial release. Basically, it's kind of like massage for the extensor muscles here and here, and then we'll focus on the flexor muscles at the bottom. Okay. All right. Okay.
The older you get, the more your ankles start looking like grandmama biscuits.
Your ankle, your finger, the skin, like it wrinkles.
Everything get fat. But I ain't wrinkling, thank God. Don't say that again. I rebuke that. No wrinkles. I'm hoping to at least get to 45 before I start looking at my face seeing wrinkles. At least, hopefully, yeah.
That's something we can't really fight.
I know.
We tried to fight it at least, you know what I'm saying? Like
yeah.
Some people do Botox to kind of get the wrinkles.
Oh no, I'm not doing that.
If I'm old, I'm old. The thing is, I have nobody to impress, so.
You still want to look good for your beautiful wife now.
I mean, yeah, of course, but
you know, you aging well, Doc. You know, we've known each other for a long time, and you look exactly the same. But you know, for me, it's more personal because I look just like my mom. Oh yeah. So I would never do no Botox or anything that's gonna alter my features because I love looking just like my mama.
That's special right there.
Yeah, exactly. So I'll embrace the wrinkles when they come because like you say, it's natural, it's gonna happen, but I'm just hoping at least to make it to 45 before I start seeing them.
That makes sense.
And it's all in how you care for yourself, though.
That's true.
Good, no stress. It's internal and external. So good skincare, good hygiene, taking care of yourself, and then internally, no stressing, eating the right things, exercising, maintaining your physical health. All of those things help you maintain, your youth as long as you can.
That's true.
Because it's really never about looking good. It's just about being healthy. It's about
your health. And then you look good in the process.
Exactly. Because if you have good health, it's going to show.
That's true.
You know, exactly. So you always want to focus on your health first.
That's true. So now I'm going to focus on the bottom, which is the flexors, okay? Okay. So this right here is the muscles here. They're responsible for plantar flexion. When you do this, the muscles up top, which that was the muscle that I actually worked on, those are responsible for dorsiflexion, which is this motion, okay? All right. So someone who's ticklish, you're not really like...
Well, those are more firm, touches. Like if you got to just trying to... use your fingertips and wiggling around. I'm going to bust out laughing, I'm telling you.
You didn't think you were going to get your feet treated today, right?
No, I didn't. I'll be looking forward to the back because I know my back jacked. I got the back. It's funny. I think I told y'all this before. When I had went to see the back doctor and found out about my lower disc, he said, "This is something I only see on my elderly patients."
You were in your
He's like,
early 30s then?
What have you been doing? Yeah, and back when I saw him, I was only in my early 30s. I think maybe 30. Like I had just hit 30. Like 30, 31.
80 and 90 and be okay?
Oh, yeah.
While other people, you smoke for like 5 years and you have lung cancer.
Exactly.
So different physiologies for everybody.
It was so funny. It was this gentleman, elderly man. He had lived to be like 100. And of course, news people got wind of it and they went to interview him. And they said, "What's been your secret to, staying healthy to live this long?" And this, that. He said, I don't know. I eat bacon every day.
I've seen something like that, though.
Yeah, do you remember that?
Yeah,
It was
I remember
some
seeing
years
something like
ago.
that.
Yeah.
This guy was like, I eat beef.
He said, I eat beef. I eat bacon every day. He said, I don't know, but I'm still kicking. Like,
you know, it's hereditary. So sometimes
yeah, exactly.
It's kind of like, you know, like high blood pressure. You know, some people will do everything they need to do and still have high blood pressure.
And still have high,
yeah. So unfortunately, sometimes we get the wrong genes, you know.
Yeah.
Like my mother died 2 years ago, but
oh my goodness, I'm sorry.
You know, I mean, it's okay. I mean, we don't have to go, right?
Yeah.
But my mother's sister, she's 112.
Wow.
Yeah, and she lives in Haiti.
Oh, wow.
And the other day, my sister had me talk to her. And I'm like, okay, because I don't really know her like that.
Yeah.
But then I was like, well, okay, she's 112, so, you know, somebody's helping her. She's bedridden, you know. That lady talked to me. She talked to me. She was cooking for people. It
really?
Was just, I mean, like,
wow.
Straight conversation.
Wow.
No problems whatsoever.
But you know what? Another thing I think, a lot of stuff we eat here and what they do to our meats and vegetables even and stuff, it's not good. I think that contributes to, a lot to our health, because in other countries that's not uncommon.
Yeah,
because their foods don't get pumped full of steroids and chemicals and things. And then, you know, a lot of people, they grow their food, they raise their own farm animals.
They walk a lot,
and they walk a lot. You have a lot of physical activity, which helps the health. So they tend to live longer, healthier lives. Yeah, that is a disadvantage. I don't want nobody to beat me up. I'm happy about my country, whatever, but I like to say the facts.
That's true.
And a lot of reasons why our health failed, Americans' health failed, because they give us bad food.
Yep.
And I was intrigued to learn that a lot of stuff the FDA approves here, they don't approve in other countries. You know, so it's really about being very particular about what you eat.
That's true. We're going to work on the bottom, so work on the flexors. Okay.
I was going to do them last night, but I thought I had another fresh razor. You know, you got to replace your razor and the thing. You can't use the old one because you put your foot at risk of getting infected.
Infections, right.
So I was like, dang, so I ordered one on Amazon. I said, damn, I'm out of razor. I'm out of blades. And they weren't horrible, so I said, they all right. Yeah, they're not horrible.
It doesn't look bad at all.
Even that last time when I came, I just ain't had no polish on my toes.
Oh, okay.
Sometimes I just like to do clear polish.
Do you do them yourself or you do
Yeah, I'll go just to get like a spa pedicure, but I like to tend to my feet the most because, you know, customer service is just horrible these days. You're trying to tell them what you need and this, that, and that, and they sitting there fussing with you and not doing what you ask them to do. So mostly I do my feet, and then I just go for, you know, the mud mask, the scrubs, the hot towels. I just go like for that. But I do the maintenance more so myself.
It's a lot of maintenance being a woman, I tell you that.
I know. You know, men is just like skincare, haircut, and that's it. Put on a nice outfit. Yeah, dental, skincare, and haircut, and y'all good to go.
Yes,
we got all that, but then we got nails, hair.
All right, how does it feel?
Oh, it feels good.
It feels okay?
My little piggies.
All right, let's have you go ahead and sit up for us.
It's hard-working feet. It's Black woman, hard-working feet, okay?
I'm going to have you on your side. We're going to do your lower back.
Okay.
Okay, perfect. Drop your head down, good. You're going to grab your arm like this. Good, okay. Bring your body a little bit closer to me. Good, perfect, right there. Good, good. Go ahead and take a deep breath for me. Let it out. Relax your body. There we go. Yes, yes.
Just heaven.
Just heaven. Let's have you come to the other side. Take a deep breath for me. Let it out. Good. Okay. All right. Good. Just let everything go. First, I'm going to check your range of motion. Good.
Mm. Chill. Oh, that feels so good. I've been dealing with a lot of tension in my neck. I don't know what it is. And I think I did it to myself. So I had my hair out and I was trying to make some curls last, so I was sleeping like this.
Oh, try to,
mess my neck up, baby.
The price
Because I didn't want to put more heat back in my hair, and I was like, oh, I need to lay off my braids for a minute. So I'm sitting there trying to make my little Shirley Temple curls last, child.
And now you got neck pain.
Yeah, now my neck all stiff. I let them curls go after about the third night. I was like, all right, y'all got to go. Y'all got to go. Ooh, that one really. Ooh. Yeah, because this side was the worst. That feel good. I'm going to let all this tension go that was up in here. That one was personal.
That's not too bad.
No, that felt great. Whew. Let me see. As always, brand new woman, man.
Oh, you're showing off now.
Yeah, that feels great.
Not too bad. So we're going to stretch you, and then after that, Shaquan is going to massage you after.
Yeah, she has the best massages. Yes.
This is the bad shoulder. Well, let's not say bad shoulder. This is the shoulder that had the surgery.
It's the limited shoulder.
Yeah. Is this uncomfortable?
Because she do still pack a punch.
Okay. And then this is the shoulder. That's really good. Okay. A little bit of popping. So just drop both of your arms out. There you go. Good. And if anything gets painful or uncomfortable, you let me know. Okay. And we're just going to let it go. There we go.
Oh,
good.
Sorry.
Yeah, I know
y'all know I got trust issues and control issues.
There you go. Good. Take a deep breath for me. Let it go. Good. Relax. Okay, we're going to bring it back a little bit. Is your shoulder okay? Okay, good.
You know, even if it does hurt, it's still good for it. Because I have to,
Yeah, you have to move it.
Yeah, exactly. Yeah.
All right, let that go.
That's one thing I always...
No, go ahead. Finish yours.
No, sorry. That's one thing I always tell people, therapy is not painful.
Right. No,
some people, I remember walking into therapy so naive, thinking that, oh, it's going to be hot towels and massage. Hell no. No. That's not what it is. It hurts, but it pays off in the end.
Yeah. Relax. Let the arm go. There you go. Perfect. All right. Okay, take a deep breath for me. Let it out. Bring that back a little bit here. There you go. Perfect. Good. Okay, we're going to isolate the shoulders, so we're going to do one shoulder at a time.
Okay.
Good. So you're guarding it a little bit.
Okay, sorry.
Yeah.
It's a force of habit.
Yeah. There you go. Good. Perfect. Good. Let's go to the other side. Just let that arm go. There you go. Good. Perfect. Deep breath. And let it out for me.
Oh, I feel good.
Yeah. So I'm bringing this one a little bit further back because, no surgery on that one. So relax. Good. And let that go for me. There you go. Perfect. Good. Okay. All right. So let me have you on your back. Yeah, let's have you on your back for me. Take a deep breath for me. Let it out. Good. We're going to go to the other side. Let it out. deep breath. Let it out. Good, good. Perfect. Relax, deep breath. Out. Deep breath. Out. Actually. Yes. Good. Let's go to the other side. Deep breath for me. And go ahead and let it out. Nice. Perfect. Good. All right. Go ahead, take a deep breath for me. Let it out. Let your body go.
Oh, I feel like I'm gonna fall.
You're not gonna fall. Good. Perfect. Okay.
I'm working on my control issues, y'all.
You gotta let it go.
Okay.
Deep breath. Let it out. Nice.
Okay. Good. Oh, I see. Yeah, because the first time I was too tense.
You were too tense, right?
I think I did that to my rib myself because I was being too...
right, you were holding on too
okay,
tight.
Yeah.
All right. Take a deep breath for me. Let your body go. There you go.
That's good.
Yeah. You see the difference? Good. Perfect.
That's the side my sciatic nerve be acting up on. Yeah. It felt good for that. Yeah.
Relax. Deep breath. Let it out.
Oh, yeah. Whew. Nice. That felt good. Yes, because let me tell y'all something. That sciatic nerve messed up, baby. Oh, what Mike kept saying, my whole, who was that said that back in the day? My whole left side.
That's not too bad?
No, that felt really good, yeah.
Okay.
It relieved a lot of that tension.
Tension the
right
lower.
Because about right in here, my buttocks, right in this area, it gets really achy and really stiff, and then it starts running on down to that leg. So
I see.
That stretch right there helps a lot with that.
So let's have you on your back for me.
Okay.
Deep breath for me. And let it out. Good. Relax. You're really tight. Let it go.
That hamstring.
Yeah, let it go.
So I got a funny story about that. So this leg actually usually bends back a little further.
Oh, really?
But I was up late one night after coming from having a little fun out. And I went in the living room and just started dancing. I don't know if you know, like you have nights you just in your own vibe. So I think I'm in my 20s. I try to go do a split again, like I'm back in my 20s. Pull my whole hamstring.
That's why it's so tight.
It's been tight ever since. Yeah. You know, sometimes when you in your influence, you think you're invincible.
Right. Relax.
And you can tell till you see it's really tight.
Really tight.
Right in here, it's really tight. Yeah. There you go. Because this was the leg that was more flexible, you know, because this one was but I messed it up. I sure did.
Take a deep breath. Let it out. Good. So now it's going further. There you go. Nice. You can let it go. Perfect.
Yeah, because I haven't done much stretching on it since I pulled it.
Since you pulled it. All right. Bring that shoulder. Not yet.
Okay.
So you're out here drinking and then partying and thinking you can do
No, I don't party. I was just, me and my homegirl had just went to like a little spot. We had ate dinner, had some drinks, and then we came back in and drank a little bit more, hung out, and she fell asleep on me. And I wasn't tired yet, yeah. And so she was back asleep, and I'm all in the living room dancing like I'm a young girl by myself. Because, you know, I enjoy spending time with myself. I always encourage, you know, people always feel like they have to be out, you know, around people and doing stuff. But you can kind of just enjoy having your own little time to yourself.
That's true.
And I was having too much fun.
Too much fun.
And I know I already got enough dealing with my body. Why would I even think to do that? But I did it. Messed myself up. That thing hurt for like a week and a half.
Yeah, hamstring. When you pull your hamstring, that's very hard.
Yeah, it went on for about a week and a half, 2 weeks before it stopped hurting. But then it's just still been really tight since then. Yeah.
Grab both legs.
Okay.
Deep breath. Let it out. Good. Yeah. And you can let it go. Perfect. Good. Good. This arm like this. This is the shoulder with the surgery, right? Okay. Take a deep breath for me. Let it out.
Oh, yeah. That felt good.
One more time. Deep breath. And let it out.
Oh. Whew. Okay. I could tell I ain't stretched that muscle in a while.
Tight.
Yeah.
Let's come to this side.
Okay.
Bring your body here. Good. Stick here. Put it right there for me. Good. Deep breath. Let it out. Good. Good. Perfect. Deep breath. Let it out.
Oh.
Good.
Whew.
Now, this is the bad shoulder, so we're going to do it a little bit differently. Bring your body here for me. Good. Put this leg here. Okay. Deep breath. Let it out. Relax. Good. Perfect.
Whew.
Good. Deep breath. Out. And go ahead and slide forward for me. Good. All the way, all the way, all the way. Good. Good. Perfect. This time you come back up. All right. Take a deep breath and blow it out. Good. Perfect. Good. Yes. And come back up. Now, you're going to put both legs on the table.
Okay.
Reach for your toes.
Okay.
Take a deep breath and let it out. Nice.
Ooh.
Perfect. Good. One last time. Deep breath and let it out. Good. Let it go. Nice. Yes.
Ooh, child.
Last one. You're going to sit, face this wall. All right. So I want you to just drop the arm for me. Take a deep breath. Let it out. Let your whole body go. There you go. Ooh. Yes. Good. Nice. I'm going to go to the other side. Take a deep breath for me. Let it out. Let your body go. There we go. Good. Nice. We're going to do it one last time on the other side. Let the arm go. Relax, deep breath. Let your body go. Nice. Mm-hmm. And one last time on this side here. Let everything go. Deep breath. Let it out.
Oh.
Yes. Perfect.
Okay.
Good. Okay. All right. So get up, move around. Let me know how you feel.
Oh my goodness. Oh my God. Yeah, that feels good.
In the shoulder.
It's
right?
less tension.
Less tension, yeah.
Mm-hmm. Yeah, that feels real good. Especially my back, right up in here, like where I was telling you it was hurting it. That felt real good.
Not bad?
Yeah, I can still, yeah. And my hamstrings are a little looser.
Mm-hmm.
Yeah. Great.
Don't mess your knee up now.
Right? Oh, you see this leg was up.
Oh,
okay. Yes, that felt good, Doc. Yeah.
All right.
Yeah,
so
especially right up in
lower
here.
back,
yeah, because I was feeling a lot of tension here last night. And it's like, I don't know what muscles these are right here, but it was like they were tightening, like really, really bad. Yeah. So, yes, that felt great. I can't get rid of them back flaps to save my damn life. I'm trying to wear little bikini tops. It just be swallowing the little straps up. Girl, this is your gift.
Is this your sore shoulder?
Oh, no, it's all right. But it's okay, though, because a little pressure on that one is bad.
You okay?
Mm-hmm. Okay.